Hi, welcome to Chapter 28. We are going to cover the neoplasms. A couple of different things that with the neoplasm that I want everybody to do right now is to go ahead and tab. There is a neoplasm table. So in your book, take some time, look for the neoplasm alpha section, and go ahead and get it tabbed. Okay, so one thing when coding neoplasm, the first axis is the behavior, second axis is the anatomical site, and then we get into just 5 different behavior groups. Okay, let's just talk about malignant neoplasms. These are characteristics of what a malignant neoplasm actually is. Keep in mind these tumor cells, they extend beyond the primary site. And what they do, they attach to adjacent structures, and then they spread. Okay, they spread, they're aggressive, they're invasive, which means they're extensive of tumor cells to adjacent sites, and everything that spreads is referred to as metastasis. So invasive neoplasm, this would be like malignant melanoma of the skin. It requires excision beyond the tumor site. So that's why if you ever seen anybody get anything taken off for cancer of the skin, they take more than just the spot. They take, again, a lot of the skin around it, just to make sure that they get everything at that one time. And then one thing to remember is the original path report and file within the record. Neuroendocrine tumors, these, again, the biggest thing here is to remember that you have the foregut, which is the bronchi in the stomach. You have the midgut, which is your small intestines and appendix, and the hindgut, which is the colon and the rectum. Okay, so we're going to go past these. I want to get into the meat of what we really need to be doing here, but make sure you read through these slides. Like I said, I'm going to try to keep these lectures brief, not read off the slides, but I want to show you how to code the neoplasm section. So let's go to benign tumors, okay? These do not spread, okay? But they can be such a big tumor which it could cause impingement, displacement. It could require surgery. Your carcinoma in situ, these are tumor cells that are undergoing malignant changes. So these are other terms right here that mean carcinoma in situ. You'll see a lot of times severe cervical or vulvar dysplasia will be carcinoma in situ, that, there is cancer cells there and that they could be at that point changing over to malignant. And then you have some with uncertain behavior. Okay, so what I want to do here, then we have unspecified behavior, master lesion. Okay, we get into morphology classification. This refers to the form and the structure of the tumor cells. And with this, the tissue or the origin and the type of cells often determine how fast it grows, severity, and the type of treatment. And again, your metastatic neoplasm are identified at the metastatic site by their morphology. Okay, tumor registry. You should have learned this from, health records management. We talked about registry. This is just another registry that cancer data is used for patients. Okay, so how do we look for a neoplasm code? Okay, first of all, we always start in the alpha index. Okay, and you look at the morphology type. So one thing here, so if I have renal cell carcinoma, it's listed in the alpha index under the main term carcinoma, and then the subterm renal cell. That's a piece of cake. So that is C64, and then we have to look in our tabular to get more information. Okay, so let's say I look up a sarcoma, and it's Ewing's. Okay, here is where our neoplasm table comes into effect, and it tells us where to go in that neoplasm table. So here it says C, neoplasm, bone, malignant. So now I know that I have to go to the neoplasm table. Okay, so again, keep in mind you have the same alpha as I do. Okay, so keep that in mind. So with this alpha here, yours just as on paper, so whenever I look up the word carcinoma, a lot of these, as you can see, it tells you see neoplasm malignant by site. That means it's telling me go to my neoplasm table. Okay, so with this, when we go to just different types of carcinoma cancer, the majority is going to be to the malignant, by site. But let's just say that it's a liver cell. It does give us the C22.0 code, okay? Merkel cell 2, again, this is a type of carcinoma. But if I want to look here at a certain spot for the carcinoma, so if I want to go to a sweat gland, it's a C neoplasm skin malignant. Okay, so just looking here, you have the diagnosis table. We talked about drugs already, external cause. These are all certain tabulars in your paper book. Here we have the tabular for neoplasm. Keep in mind, when you have your neoplasm table, we have malignant primary, malignant secondary, carcinoma in situ. We have our benign, uncertain behavior, and unspecified behavior. Okay, so if I want to, let's just say I'm going to put in skin. Okay, and here we have a bunch of different things. Where's the skin at? Carcinoma of the skin. Is it of the breast, basal cell? Okay, and if you can see here, we can only code malignant primary. Okay, and here it gives us the tabular down below. All right, so on that note, we are going to go back to the PowerPoint. Okay. All right, the neoplasm table, again, this lists anatomical sites alphabetically on the left. Columns to the right indicate the behavior type. So again, you are going to find the behavior type. So again, let's go back to the table. These are our different types of sites, as I just talked about before. All right, so we have either solid neoplasms, hematopoietic and lymphatic neoplasms. We have characteristics of those solid tumors, single primary. Again, just read through this. This is kind of your basic anatomy and physiology, what you need to know. How does our metastatic neoplasm spread? Direct extension, they metastasize, and we'll get into that because you really have to know the word metastatic and secondary and how to use it in a statement. We have overlapping sites, okay? These would be contiguous sites, so then you're going to use your fourth digit 8 with those. All right, so let's go to metastasis. Metastatic or metastasis, they're used the same to describe neoplastic disease, okay? You could refer to the primary site, could refer to the secondary site. If the diagnostic statement's unclear, we need to look through that record for more information. But for this year, you should be fine. Let's say metastatic 2. Okay, so we have, for example, metastatic carcinoma to the lung. Okay, for it to be metastatic, we know that there's 2 sites. Okay, but at this point, it's not telling us. We know that the primary site, we don't know what it is, but we know that it's spread to the lung. So looking at this, I'm going to assign C78.0 secondary malignant neoplasm. Okay, then also I would code the primary if it was, again, noted, and we'll get in a little bit more of that. So let's just go here. I'm going to go ahead and put in lung. Okay, and you will see here malignant secondary. There's primary. Secondary, then I need to know what lung that it actually, the secondary cancer was at. Okay. Metastasis, again, we have a former site of primary malignancy. Okay, we have subcategories for history. When you are in the history section, okay, make sure a couple of different things. Make sure you're in, if this patient is a personal history of breast cancer, personal history of prostate cancer, make sure you are in the correct area. So when looking at this, I'm going to go in the diagnosis section, so the first part of your tabulary, tabular. And you can see here we have family history. Okay, I'm going to go personal. So then you're going to go history, personal. You're going to look for personal. And then I'm going to look for neoplasm. Okay, and then if I have a personal history of brain or benign brain, again, here we have just kind of goes through in situ, and then if malignant, then you're going to go see history of malignant neoplasm, and that's family, but we want to go to personal. So make sure you always get in the right area. Here's personal, and then you're going to go down to malignant neoplasm. So again, you have to do some scrolling. And then if I had a personal history of malignant neoplasm of the bone, okay, let's just say that they cured it, went away, and then I would code the personal history of the neoplasm. Okay, so let's go back to this. And then again, to show a history of a former site for a secondary malignancy, assign a code from the Z85 section. Metastatic from, this indicates the primary site. So if 2 or more metastatic sites are described, each site is coded as secondary or metastatic. So also code the code for primary if you have the information, a code C80.1 if the information about the primary site is not available. So when coding a site described as metastatic without further qualifications, we want to code them. We want to code them both. And again, one thing you have to look at is how are they saying it? Okay, how are they going about it? If morphology is not stated, you only code the C80.0 and C80.1. You assign the code for the primary neoplasm unless the site is one of the following: bone, brain, diaphragm, lymph nodes. You go through all those. Malignant neoplasm of these sites are classified as secondary, very important here, and this is listed in your chapter, Metastatic 2, so just keep that in mind. So make sure you review this table in your chapter. Okay, metastatic site unspecified. Neoplasms of lymph nodes and glands. Okay, and then we have just the different types. These you can look pretty much up: lymphoma. Okay, non-Hodgkin's lymphoma. All right, so what I'm going to do, we get into remission here. I am, with the remission, we have leukemias. So again, it has to state for you to use that 4th character. Okay, again, you have to have documentation for these. Designation of principal diagnosis is the same for neoplasm as any other condition. So whatever brought that patient in after study to occasion their admission, this is going to be your principal diagnosis. All right, so with that, I'm going to start up another video. What I want to do is have you go to exercise 28.5, and I kind of want to discuss that. So after this, so what I want you to do going through there, you tell me which one, label which one's going to be primary, which one's going to be secondary, okay?